I am Dr. M.L. Bhansali. I am practicing in Howrah, West Bengal for last 40 years in internal medicine. Today we are going to discuss about blood lipids. We know that incidence of coronary artery disease, cerebral stroke, peripheral artery disease, they are increasing like anything, and in India we are witnessing more and more young patients suffering from acute heart attack, or we call it as a myocardial infarction. So behind all these pictures there is one thing is common, that is high blood lipids, and we know that lipids are LDL cholesterol, HDL cholesterol and triglyceride. We generally measure these three. So LDL cholesterol is low density lipoprotein, HDL cholesterol is high density lipoprotein, and third is triglyceride. So when lipids goes inside blood, they are not dissolved in blood, so they are carried by lipoprotein molecule which engulf them, and low density lipoprotein is a bad cholesterol, high density lipoprotein is a good cholesterol, and third is triglyceride, which is also a cause of heart disease. And normal values for these cholesterol, optimum value for LDL cholesterol, it is around about 100 mg%, and we see that many of our patients, they are having high LDL cholesterol, and some are having genetically very high cholesterol, so that they are suffering from heart disease more as compared to other population, that is heterozygous or homozygous hyperlipidemia. Normal target value of total cholesterol is 200, but LDL cholesterol should be kept below 100 mg. And when a person is diabetic, then as we know that in diabetes incidence of heart disease is increased by 2 to 4 fold. So in these cases our LDL target becomes 70 mg%, and if a person suffer from any cardiovascular disease like myocardial infarction, that is heart attack, or paralysis due to thrombosis in cerebral arteries, that is blood clotting, then our target become still less, that is less than 55 mg LDL cholesterol, and our HDL target is more than 40 mg in male and more than 50 mg in female. And we know that HDL cholesterol, it takes out LDL cholesterol which is deposited inside arteries, so that this atherosclerotic process or incidence of heart attack is reduced. And third fat is triglyceride, and we know that if triglycerides are high, then LDL cholesterol, in LDL cholesterol there is also small dense LDL cholesterol and high dense LDL cholesterol. So if triglycerides are high, then small dense LDL cholesterol number will go high, and small dense LDL cholesterol will easily penetrate inside our arteries and will cause atherosclerosis and heart attack. So we have to reduce triglyceride also. So how to reduce it? We know that foremost important is lifestyle measures. What we eat, how we do exercise, that is more important. So if one does exercise regularly, it will reduce LDL cholesterol, it will increase HDL cholesterol. It is recommended that moderate intensity exercise, at least 150 minutes per week should be done to keep our heart healthy. And it will not only reduce LDL cholesterol and triglyceride, but it will also increase HDL cholesterol. So any type of exercise, whether it is sports, whether it is swimming, gym, or normal walking or brisk walking, it all will help. It will help in young population also, in elderly also, If they are doing normal pace walking, it will help them to protect their heart and cardiovascular diseases. And then we have to modify our food. We see that when we eat high fat diet, today we are eating a lot of high fat diet, that is saturated fat and trans fat. So saturated fat, all these cookies and that is vegetable oil, vegetable ghee, that is saturated fat, and tropical oils. Many of the tropical oils, they are having saturated fat. So the fat which becomes solidified at low temperature in winter season, that is containing more saturated fat as compared to oils that are liquid at low temperature. That is in winter, if it is remains liquid, it means it is having less saturated fat as compared to those which are solidified at low temperature. So we should eat less and less of saturated fat. So which oil is good for heart? That is, if it is pure mustard oil, canola oil, if it is rice bran oil, or this groundnut oil or soya oil, these all will help to keep our LDL cholesterol low. And these tropical oils like palm oil containing a lot of palmitic acid and lot of saturated fat, so that is not good for our heart. Then comes the trans fat. So anything that is fried or there is repeated heating of oil, that become trans fat. Like in Indian dishes, in vegetarian dishes like bhujia, kachori, pakodi, like these are fried in oil, and that oil is reheated. So more and more oil is reheated, it becomes trans fat. We know that when we cook vegetables at home, we can hardly eat on second day because it is unsaturated fat and it becomes attached with oxygen, so aldehyde is produced and it becomes rancid, so we cannot take it. But when we fry the food, by frying we saturated all the double bonds, and by saturating that shelf life of that food product is increased by boiling it in oil. Like bhujia and all that snacks which we prepare that last for many days, so its half-life is increased. And when we take in our body, it is highly atherosclerotic. It will increase the plaque formation, it will increase the heart disease, and in body also its half-life will be increased. So trans fat is most dangerous fat. So we should avoid trans fat. We can use monosaturated fat, that is found in nuts and all the these almond, cashew nut, all these are containing fat, monosaturated fat, that is good for heart. And oil we have already discussed, they are good for heart, but saturated fat and trans fat, that is very dangerous. Then if we take excessive sugar, if we take excessive refined carbohydrate like maida, that will increase our triglycerides, so that will be harmful to our heart. And what should we take? We should take whole grain product like atta, whole grain. If it is containing all the layers of this grain, this is good for heart. We are taking oatmeal, that is in all time, oatmeal means any food grain that is cut in pieces, we call it as a oat. Like if wheat is cut in pieces, that become oat, and it contains all the layer of wheat. Like desi dalia, that is oatmeal. So that is good for heart because it contains lot of fibers, and it will act like a broom in our intestine, and it will reduce, it will absorb the cholesterol, it will broom out the cholesterol from our intestine, so it is very good for heart. So we should take more and more fibers like green vegetables, leafy vegetables, fruits. In all the lentils, dals, there are a lot of fibers, so we should take lot of fibers. It will not only will reduce our LDL cholesterol, but it will also keep our intestinal bacteria, large intestinal bacteria healthy. So by keeping large intestinal bacteria healthy, they will maintain our immunity, they will maintain gut microbiota, and they will salts and fatty acid will be formed by gut bacteria, that will be anti-inflammatory, and that will be good for heart. So we should take lot of fibers. We should avoid all these fatty food, fried food, like food which is containing lot of fat, that is say meat, red meat or processed meat that is containing lot of fat. Of course, seafood which is containing fat, that is fatty fish, that fat that is good for heart, but if we fry it, then it will converted into trans fat. So it should not be taken fried. It can be steamed or boiled. So it should be taken in that way. By frying, we will destroy all its natural good effect, and it will be converted into trans fat, that will be more dangerous. So if after exercise and diet we are not able to control our LDL cholesterol, then there are so many good drugs. That is, one is statin, like rosuvastatin, atorvastatin, that will reduce our LDL cholesterol. Rosuvastatin, it will also increase like HDL cholesterol, and if not controlled, then we can add ezetimibe, or we can add bempedoic acid. For triglyceride, we are having fibrates, and now latest has come, that is PCSK9 inhibitor, that is evolocumab or alirocumab. They are injectable form, they are very costly, but in critical situation they are very helpful to reduce LDL cholesterol. By them, LDL cholesterol can be reduced even less than 40 or 30, so that we can avoid heart disease, or we can treat our coronary disease by taking statins, by taking this ezetimibe, by taking bempedoic acid or PCSK9 inhibitor. Whatever your doctor advises according to your condition, you should follow them. So to have our heart healthy, we should do regular physical exercise. We should avoid diet which is rich in saturated fat, which is rich in trans fat. We should take lot of green vegetables, leafy vegetables, dal and salad, natural food we should take, and we should avoid mental stress and strain, so that we can lead a healthy life. Thank you.
Thank